Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Allison Cole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same.
Hello, everyone. Okay, bar none, the coolest episode of the season is happening right now, which is I have Dr. Julie Foucher on the show. Okay, so welcome to the Sleep is My Waking Passion podcast. I am your host, Dr. Allison Cole, and I get to bring really cool guests to you. Dr. Foucher, she's a very uniquely positioned figure. I'm going to do your intro in a little bit. I just have to say how I got to even know about CrossFit. Very true story. A lot of us doctors have historically been a more of do as I say, not as I do, because the current medical model sort of promotes learning how to treat disease, not necessarily learning how to prevent the disease. And I think you and I are both aligned in that we're really trying to preserve longevity and health. And if we can stave off chronic disease, the likelihood that you will live to an older age is probably higher than if you're living with a lot of chronic issues that need to be managed. And in that transition, it also meant that I was a pulmonary critical care physician. I'm now focused entirely on sleep. But during that pulmonary critical care internal medicine days, I went from being this med student who valued exercise, and I managed to, especially my last couple of years of training in medical school, to be able to exercise pretty routinely. And then all of that kind of fell out the window. I had never heard of what the heck CrossFit was. So you're taking someone who used to exercise and then fast forward internal medicine residency and a Pulm Crit fellowship later. I now have my very first job in JERS. And I meet this woman and she's got these like really strong shoulders. And I'm like, what the heck do you do? And she's like, hey, well, I CrossFit. And I'm like, well, what the heck is that? This is and it's funny because I think your very first foray into the CrossFit Games was like 2010. Mm-hmm. And that's around the time that I got I graduated and had my very first job. And so I go to my very first CrossFit class and I'm like embarrassingly dead, like literally peel me off the floor. I was like, this is crazy. These people are in this amazing, amazing shape. And then I learned about you because I was like, whoa, there's this chick who's like a med student doing this. And not only that, she's like getting on the podium. Like I was so amazed by how you could balance all of that. And I think that really lends itself well to a discussion. So you really shaped my desire to even continue in fitness and kind of feel like it could be part of my life post training. And I especially was like, could I reverse time and maybe have incorporated this a little bit more when I was an actual resident and fellow, and how you were able to manage to balance it and then kind of steer your career in the direction of really moving where I think medicine needs to go. All I can say is amazing.
Oh, well, thank you. That is so nice. And so it's so amazing to meet you. This is one of my favorite things, is to meet other doctors on a similar path and a similar mission and with similar experiences. So there's so much we can talk about there that you just opened up, and I'm excited to be on your podcast.
Awesome. Okay, so I'm going to do my official intro now. Julie is a uniquely positioned, she is a uniquely positioned public figure, okay? She, at the intersection of medicine, athletics, and wellness, and no joke, it really is at the intersection of all of these. She's board certified family physician. She has competed in the CrossFit Games 4 times. She was in medical school doing this. Your final was 2015. She has consistently finishing in the top 5 with the podium, finishes 2nd in 2012 and 3rd in 2014. And I listened to your episode on that journey of mental fitness. And even though I watched you, I knew you got injured. I was watching the CrossFit Games. The fact that you're a huge example of resilience and just taking something that could have been like, oh, this is it. I'm going to give up now because I did all this mental work and I did all this physical work and now it didn't work out, so forget about it. You actually have a completely different philosophy on that. And that is something that we can all learn from. Okay, so on top of all of her physical accolades, let's talk about you going to Cleveland Clinic. You graduated from the Lerner College of Medicine. While you're training for all of this, crazy, you're now a precision health physician with Wild Health. I actually did a personal consult there, and you're the host of the Pursuing Health podcast, celebrating 10 years. I've been at this since like crazy. 2023. How you've managed to keep this up for 10 years is like awesome. And I'm glad that you were talking about how your mission has sort of evolved and the podcast is even changing. And that's the joy of being in medicine, is you get this background and font of knowledge, and then you really can grow and kind of evolve your career. She also happens to be a board member of the Primary Care for All Americans. Again, I talked about your MD. What else do you have? Okay, a master's in science and nutrition from Case Western Reserve. You've completed integrative medicine in residency curriculum through the University of Arizona. And essentially, through your medical training and through your CrossFit career, you realized your passion and your unique position to help patients maximize their health through lifestyle. And you also are committed, which I really appreciate because I am too, to transforming primary care delivery to achieve this mission. So these are really, really lofty aspirations, and your trip to the podium just makes it that much more formidable. So again, thank you so much for being here. You're like famous, so I almost feel like I'm like Instagram handles. Like, this is kind of dumb. People will know where to find you, but they will nonetheless, if you've never heard of her and you don't know CrossFit, which the meme is everybody knows CrossFit, because if you know one person who does CrossFit, the funny part is they never stop talking about CrossFit. So at least that's the joke for years running. What I wanted to, I guess, start off with, because the one unique thing that kind of catapulted me away from the traditional medical course, mine happened kind of post-COVID. But what really kind of led to my trajectory, knowing I needed to change, was I reached a point where I just hit a wall, and my sleep was the wall for me. It really made me insane to not be able to sleep. And I think COVID was a re-triggering of that, which I had compensated for in medical school just by saying, I'm going to stay up late. I'm going to pull up all nighter so I can get, P equals MD. I got to pass those exams. Then it became rotations. And for me in training, and you may have noticed this, I will say surgical rotation was the specific real one. I mean, people just bragged about the fact that they pulled all-nighters and didn't sleep. And it was like a badge of honor. Like, why are you going to sleep? You're weak if you need sleep.
Totally. Yeah.
Right? I'm not crazy for that. And I was very curious about, I guess I would say, do you think that your sleep suffered balancing this really high level competitive sport that you're in plus medical school? That's, I guess, question number one.
And then great question.
And then I want to also get, if you feel comfortable talking about this, if you think it contributed to your injury in any way.
Okay. These are,
I'm curious.
Whoa.
Yeah.
Thank you for all of the intro and the kind words. It's very nice of you. I think I also like to point out that as we get more into it, sometimes the bio and what you read, like, oh, medical school and CrossFit, it was a crazy time, and it was so cool for me to be able to do both those things at once. But it's not always like the headline. So there's always some background to that. And I was able to take, as part of the curriculum at the Cleveland Clinic, Lerner College of Medicine, it was a 5-year curriculum for everyone. We all did a year of research, and I ended up spreading out my research over 2 years. So that gave me a little more time with a regular schedule where I could have regular sleep and dedicate time to my training while I was in med school, which was very nice. So I would say, if anything, the fact that I was training and competing in the CrossFit Games, it made me protect my sleep while I was in medical school in ways that I otherwise wouldn't have. And what I did was I competed during my first year of med school. During the second year of med school, which is where you take, your first step of the board exam, I actually did not compete. I took that year off because I just knew school was going to be more demanding, and the boards were around the same time as the games. And then I went back for my 2 years of research, and I competed then. So I really prioritized it. And it's funny because after I was done competing, it was kind of like, oh, well, I don't really have to take that kind of care of myself anymore. Like, in my mind, I'm like, oh, I was always so protective about everything I ate and sleeping and recovery. And then it was like, oh, does that even matter? And so there was a period of time where I had to relearn that for myself of like, okay, these are just things to do for self-care. Even if it's not for the purpose of competing or winning, it's important for me to do as a human to feel at my best and to perform at my best, whether it's at work or as a doctor or in any other area of life that I want to show up in. So there was definitely a little bit of recalibration that had to happen for me after that.
So were you able to eke out for the most part? Like what do you consider to be like an optimal amount of sleep for you? And has that changed since you're no longer competing at that level?
Yeah, I would say I really got at least 8 hours of sleep. So I think my sweet spot was probably 8.5. Like when I was really training a lot, like in competing and my body just needed more rest. Like that's probably where I landed. Now, this is also more than 10 years ago. So my memory may not be perfect. The other nice thing about the Cleveland Clinic is that we did not have exams or grades. So there was not the typical like wave that you get in med school of, okay, things are kind of calm. And then all of a sudden you have an exam coming up and it's like all-nighters and studying. And then they're kind of calm again. And then these ups and downs. For us, it was sort of like a constant higher level of stress because we kind of had to be on every day because we were being evaluated by our faculty and by our peers every day, how we showed up, the knowledge we had, how we presented things. But it wasn't like the ups and downs. And so it wasn't so erratic. So I was able to identify or like establish sort of a routine that was consistent for me. Which looking back, I'd never thought about it that way, but that was kind of a blessing in disguise, I'm sure. So I'm sure there were days like we always had this one day a week that we had to do, a presentation. I'm sure the nights before that I was up later preparing, but for the most part, I think I was able to protect somewhere around 8 hours during that time. Now, the year that I was studying for boards, I don't think that was the case, but when I was competing, it helped me protect my sleep.
Awesome. So I'm going to assume then, just based on your injury, that was just something that happened. It's just one of those things that can happen to anybody, but you really were protecting your sleep at that time. And for you to have longevity in the sport anyway, it sounds like you really were doing all the right things. And I kind of feel like a lot of people are out there and they're I'm exercising, I'm eating right, and then they never sleep. And then they wonder like what's going on.
It's hard to say if sleep played any role in my injury. I think for me, it was something that had been brewing for a long time. I even remember, if you're familiar with Kelly Starrett, who has the mobility WOD, before it was called Supple Leopard. And he had the book Becoming a Supple Leopard. And he had done a mobility WOD seminar that I had attended years before. And I remember him pointing out, I had like this, it's called a Haglund's deformity on my heel. And he's like, you've got to address that. Like, you've got to do something about that. And I think it was a little bit of ignorance or just, I didn't know what to do. And I always had plantar fascia issues and I would work on that. There was one time where I strained my calf, but it wasn't like a surprise that happened, that my Achilles tore. It's not like I had never had any warning signs of that. It was something I was always worried about and had fear in the back of my head, but it was going into a regional where there was, I think the workout had 50 or 100 box jumps and I practiced it several times before that week. So it was just one of those things that it happened at that moment. Yeah.
This is kind of not necessarily sleep related, but I was just curious if your workout regimen, as you've aged and you're no longer competing, I still see you posted this great post about a new, I think it was Amazon is doing it, but, or maybe it was Whole Foods, but somebody has like this organization and now you can like go work out and you can also eat well. And it's sort of this all encompassing, you can see your primary there, which I was like, wow, this is so cool. It's like bringing a gym and a spa and all of that together. And you were still doing CrossFit stuff, right? But I was just wondering
if you're talking about. Yes, it was Love Life. It's the same founder of Whole Foods then started this. And so, I think I'll always do a CrossFit. The CrossFit philosophy will always be the foundation of the workouts I do because I just believe in it so much. It's functional movement, constantly varied, high intensity, with intensity being relative to where you're at in life. And I would say the relative intensity has changed a lot for me over the last, it's been 10 years since I competed. And so what I do now might have been considered a warm up back then, but I'm still doing it. It's evolved for me too. I would say since COVID, I haven't been consistently in a CrossFit affiliate since COVID. I do go from time to time, but I've been doing a lot more garage gym workouts, a lot more things just in different venues and formats, but always with that same general foundation.
what I can tell you is I am consistently been working out, but now in my 40s, what I have found is, and I talk about a lot on my show and stuff, is I started doing Pilates, which I think.
Same here.
Yeah.
Yes.
Okay. I'm not crazy and thinking it's great adjunct.
I'm like sore today because I just went to a class last night and I hadn't been in a while. So yeah.
And I'm cracking up that you're saying that because Jackie, if you're listening, she is a nurse that I work with who's part of Lane Norton's kind of nutrition. Okay. And she's really been instrumental in me dialing in, getting the right nutrition. I was like, I didn't realize I was eating like hardly any calories during COVID and like 30 grams of protein. And that was not conducive to like living a healthy life. Yeah. So she got me on track. But one of the things she always jokes about, she goes, Allison, I don't really consider Pilates like, and I'm like, I'm telling you, you've not been to Katie. I am sore the next day. I'm sore today. I rocked and did Pilates yesterday and I'm like thrashed today. I'm like, all right, what am I going to do?
Well, I've definitely evolved. And it's one of those things I kind of had that same philosophy before. I'm like, oh, Pilates. But I think it was last year, I went to a reformer Pilates class with a friend. And then a few weeks later, I went to a bar class with another friend. And I got crushed both times. I was so sore. I like could barely, I started shaking within minutes of the class. And I was like, well, I think I need to be doing more of this because clearly I'm not very good at it. And isolation movements are not common in CrossFit workouts, and they're a very different kind of stimulus. So I don't know that doing Pilates only would give me the same results, but I do think it's a great complement to, a functional fitness program. And I do a lot of hiking and walking now and things like that I didn't normally prioritize before.
And so what I'm hearing from you really is if somebody is not really an athlete per se, and they get nervous because they're like, oh, you're talking to this like person that can do these crazy workouts. We all evolve with time. And I think at the end of the day, what your key word is functional. We need to remain functional for longevity, for sure.
Absolutely.
Are there any key things with sleep that you have found or have been real game changers? Clearly, you prioritize number of hours. So duration is important. We always talk about that. Are there any other key features that you think people should really kind of hammer home on, or that you even emphasize to your patients when you're talking to them at Wild Health?
Absolutely. So I will say just personally, one, I'm very blessed that I'm a good sleeper. Some people are just naturally good sleepers. Some people really struggle. But that doesn't mean I haven't struggled from time to time. And I think there's a few things I've done that have really made a difference. The first thing, actually, there's a time where I would try different sleep supplements, especially because now I do travel. My fiance works in different cities. And so I travel a fair amount and change time zones. And that's when I find myself running into problems because I think I operate best when I'm going to bed early and waking up early. But then when I shift time zones, that gets a little out of whack. So I've tried different sleep supplements. But when I started wearing blue light blocking glasses, this was like 100 times better than any sleep supplement. And it really showed me firsthand, like you read about it and you see the research on it, but firsthand experiencing the power of light exposure in your circadian rhythm was so powerful to me. So that's something that I keep them with me wherever I go, and I try to put them on at night. And so that has been really powerful. And just like it's something that we know and we talk about, this like wind down before bed. But in reality, it's so hard to do because there's always, one more thing I have to check on my phone, or like the TV's on, or it is so hard in reality. But on the nights where I do it, I notice a difference. So I think some of the things that have the biggest impact on sleep are that maybe they're not the easiest to do, but they're the simplest things. It doesn't have to be like a fancy supplement or, 5-part routine, but it's like, okay, stop looking at lights and do something relaxing before you're ready to go to bed.
And this is coming from a good sleeper, guys. And one of the things that if you're going to be going for any length of time and you want a quick cheat for travel, and again, I never get endorsed by these people.
To hear all your best stuff.
All right. Like I never get endorsed by these people, and they should, because I talk about them way too friggin' much. But there is an app called the Time Shifter app. And yeah, I think you pay per each time you go somewhere. So there is a fee involved. The advice that they give, I used it when I traveled to Hawaii for a conference years ago. And I was watching all these people like on the beach. I'm in Hawaii, right? I'm on the beach. I'm like, okay, I don't have to be at the conference today. We're going to chill at the beach. And I made my husband do what the time shifter said. You're going to get your coffee at this time. You're going to avoid light. So what I did was just made sure I wore my sunglasses at certain times. And then you're going to get light at this time. They didn't make any melatonin recommendations, though. It says, are you okay if I do that? So it asks your permission. And it's a conference. We were there for like a week or so, 5 days, or, probably a little bit short of a week. But it's a big shift. I'm based in Jersey. So to go all the way to Hawaii for this conference was
shift.
Yeah, it's a big shift. And I did what they said about 90%. The only thing I couldn't do was they recommended I stay till like 11 p.m. Hawaii time. And I'm like, guys, I can't, no, 9:30, that's what you're getting. But I felt so much better than the other people on the beach. And I heard them, they're like, this is great, but I'm so jet lagged. Like I'm overhearing this going, you didn't use the time shifter app.
It feels so good. Yeah, that's amazing. I'm going to check that out.
So check it out because it might really help you, especially if you've got to shift time zones. Totally. One of the tricks that I've heard and I have tried to deploy, though it's not always easy depending on what your obligations are at that particular location, right, is to try to adhere as much as I can to the time zone that I'm going to be returning to for a very short trip. The irony of ironies is I went to Sleep 2025 this year. That was in Seattle, and there was no time for that. I was on Seattle time the entire time because otherwise none of the stuff I needed to get done was getting done. And I came home. And I leaned into feeling that jet lag, and it really, really sucked.
Totally. Yeah. It's like, oh man, makes you really experience it and appreciate it. But yeah, no, I would say the other things, this is a little more out of the box. I don't know if you use this at all, but I did do something called Neurofeedback a few years back. And I worked with Dr. Hill, his Andrew Hill. He's out of UCLA, and he has a clinic called Peak Brain Institute. And neurofeedback is used for a variety of different reasons, and I was using it for a variety of different reasons. But one of the biggest shifts I noticed right away that was very objective was my deep sleep increased. So that was something that I found really interesting. I don't think it was bad before, but I noticed like a good probably 20% increase in my deep sleep, which was really cool.
That is a huge amount, though, because if we look at the overall amount of a normal adult person is probably only getting about 20%. And then as we get older, that starts to decrease. So what's interesting in the insomnia literature is something we talk about cognitive behavioral therapy as being a mainstay and core of what we do. One of the things I learned from the Australian Psychological Society actually is this great online course that you could take. And I actually took it not too long ago. And one of the things they talked about as adjunctive to that cognitive behavioral therapy piece, they didn't really describe it for everyone, but they talked about biofeedback, meaning that you're hooked up and you can kind of feel what's going on in your body. Is that similar? Can you describe like kind of what the neurofeedback is all about? Because this is fascinating to me.
It is. Yeah, it is similar. It's the idea that you're getting real-time feedback based on your body's response to the therapy. So for this, you start with just getting a QEEG and a brain map, and Dr. Hill reviews that with you and correlates it to any symptoms you might have. And then he designs a specific program based on your goals. And the program is you basically hook up certain probes to your head. There's like a little glue and you put them on your head. So that's the only part that's a little cumbersome is that you have glue in your hair and you have to.
Ladies, we know, if you've got enough hair.
It's easier for guys. They can just put a hat on it or whatever. But anyway, I guess I could do that too. But anyway, so then you design a program. You are just watching a screen and it's just basic like sounds and lights. It's nothing crazy, but it is reinforcing. Whenever there is a brainwave pattern that's favorable, you're getting a positive reinforcement. And then if there's something that's less favorable, you're not having that reinforced. And it just causes these gentle shifts in your brainwaves. And they have specific programs designed for specific things. And you do it for about 30 minutes, a couple times a week for 2 to 3 months, and then that usually is enough. And it's something that sticks. It's not like exercise where you have to keep doing it to keep getting the benefits. Usually 2 or 3 months is enough to make lasting changes. So it was fascinating for me. It's something that it's not super widely accessible. A lot of people haven't heard of it, but it was something that made a big difference for me.
This is, I hope that I'm going to have to go look into this, because I hope he's doing some research, because that is the holy grail almost of how can we optimize our sleep. Totally. Yes, we want everybody to get REM, but deep sleep plays a huge role, especially with like muscle recovery, maintenance of muscle, because you get the growth hormone release during stage 3 sleep. So to have deeper sleep, that's typically what a lot of people lose as we age. And a lot of older folks, even if I do a sleep study on them and I can see how much they're getting, I know their percentage is, quote, within a normal range-ish, but they don't perceive that they're really getting that restorative sleep. And the thing with sleep is a lot of it has to do with our perception. Like if you just wake up and you're like, my sleep sucks, it's hard to talk yourself out of feeling good hard that day.
Yes. That's one of the kind of double-edged swords of all these sleep trackers, right? Is it can really get in your head when you see some of those numbers.
Yes, orthosomnia, that's a real phenomenon.
Yeah.
And I have legit seen people in my clinic who are like, I really, I got this Oura ring or whatever, and, I thought it was a great gift. Mm-hmm. And now it's telling me my sleep is horrible. And I don't understand because I was sleeping so well, but now it's telling me it's horrible. So I'm literally seeing them for this. And they're like, well, my daughter wore it and it gave her great numbers. And I'm like, don't worry about this thing. Just, it's not important to you if you were sleeping. I mean, to the point where we're doing tests and I can say that there's nothing going on. And yet still they're like, uh-oh. And I'm like, oh man, maybe. But meanwhile, I'm wearing one. I use it for my steps though.
I have my Whoop and I wear my Oura at night too, because I just like to compare that. This has been so cool. Thank you. I don't want to take up any more of your time because we're reaching about 30 minutes, but it's really refreshing and really reinforcing to anyone who's listening out there. You really do need to prioritize your sleep. It ups the game, I think, for your mental health, for your physical health. It is foundational. Absolutely. This is an aside. I don't even know if I'm going to include it in the episode, but I was just curious. My experience with Wild Health, I found it really enlightening. And I was just, wondering, have you found the genetic component and the testing to be really helpful in the recommendations that you make? One of the things that I had no idea about is that my vitamin D level is always low. Whatever genetics I have, I need more vitamin D than the average person in order to kind of maintain my levels, which have been normal since I did the Wild Health visit. And I'm just curious as to, how you see the future of medicine going with precision health, because it's something I sit here and I go, why can't we do this in the office? But I also at the same time go, what if I were to get involved in this and I'm starting to do all these tests and then I don't even understand what the heck I'm checking? That's the other piece of it. Like, where do we get this knowledge and how do we know how to deploy it responsibly, I guess? I think that is all coming and it's all going to be much more accessible. But I think where I see the genetics being most helpful is, and just personalized medicine in general, is a lot of people know the right things to do, right? Like everyone knows I need to sleep, I need to eat vegetables, I need to exercise, but there's something about when it's personal to you that I've seen be much more motivating for people as far as behavior change. When they can actually see, oh, I have the gene that says I have slow caffeine metabolism and I shouldn't drink caffeine after noon. Oh, okay, I'm actually going to try that and see if it works. Versus being one of those things that oh yeah, I know that's good for you, but I'm not quite ready to make the change. So I see with sleep in particular, there's two. There's your caffeine metabolism, and then there's one called ADORA2A. And when people have that gene, they can be at much higher risk of anxiety with caffeine and altered sleep. And so it can really motivate people to try some experiments and see for themselves how, changing their caffeine intake could affect their sleep.
Obviously, that wasn't me. All I knew about the vitamin D. But I think they even check for things like BRCA. So it was nice to kind of know, I don't have that.
Different things, totally. Yeah. Like gluten, we do a whole page on gluten sensitivity, because even people who don't have celiac, there's a whole branch of non-celiac gluten sensitivity, and it's a big deal to spend 30 days and cut that out of your diet and see how it affects you. But if you have high risk genetically, or I've seen people have much higher motivation to try it. So I think, as you know, genetics are not the end all be all. They're just the groundwork. But I think they can be a really powerful tool for behavior change and for people doing their own N of 1 experiments.
And I also think it may also be kind of, again, personalized, meaning a patient dependent thing. Not everybody's going to be down for that. And then but the people that are may have a predilection to really have that data influence them in a positive way. I can certainly say it was a wonderful experience for me.
I'm going to go. No.
What I did want to kind of end with was, do you have any final words that you'd like listeners to leave here with? Any final thoughts about anything?
I liked what you just drew attention to with as far as prioritizing, whether it's sleep or at the beginning you talked about, me being in med school and the CrossFit Games. And I think life is really so much about where we put our attention. Like our attention is our greatest resource, and where we put our attention and our energy is what's going to happen for us. And so just zooming out and thinking really big in life, like you did, right? Okay, where do I want to put my time and energy? And do I want to shift my career into something that's really meaningful for me? Or whether it's, okay, I need to put my attention towards getting enough sleep every night because I know that's going to affect everything else and my ability to show up in everything I do during the day. That's one of the things that I'm constantly learning and reevaluating and shifting my own attention and energy. And we just have to stop and check in on that question really frequently, because it's easy to get caught up in just the treadmill of life and doing what you've always done or what everyone else around you is doing. And stopping and asking that question for me has been really crucial.
Thank you so much, Julie, for joining me today. This has been absolutely amazing and really something that was beyond my wildest thoughts when I first started this podcast a couple years ago. Everyone listening, go to Pursuing Health, follow her. This is the 10-year anniversary of her podcast. Let's all kind of get better together in every aspect of our health, because that's the ultimate goal. Let's all be on the planet happier and healthier for a longer period of time, doing the good work.
Struggling with sleep? Dr. Cole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.